James Evans.
Thank you, Deputy Presiding Officer, and I welcome today's statement by the Minister and the publication of the first annual report on the National Action Plan to prevent the abuse of older people. A plan that is, as you said, the first of its kind anywhere in the UK, and its ambition is significant, and the issue itself is one that all of us across this chamber should treat with the utmost seriousness. We know from the available evidence that many older people feel that services simply aren't designed with them in mind. Many are unaware of their rights or the services that are available to them. Others feel overwhelmed by the complexity of the system they must navigate. And while the data available confirms that older people experience all forms of abuse, physical, emotional, financial, domestic, sexual and neglect, older people remain disproportionately vulnerable to neglect compared to the wider adult population. Yet with these findings, we still face fundamental problems, the lack of meaningful, comprehensive data about the scale of the abuse in Wales. Without reliable, consistent information, we risk designing policy in the dark. So, Minister, when will the Welsh Government address the data gaps, and how will it ensure that safeguarding boards across Wales report information consistently and transparently so we can finally build a full picture of what older people are experiencing across Wales? I welcome some of the progress highlighted in the report, the work on the successor to the Dementia Action Plan, the Resident Wellbeing Toolkit developed with Age Cymru, support delivered to the unpaid carers through the Carer Support Fund. I think that's a policy everyone across this chamber can get behind, and the publication of the Code of Practice for Llais and a number of other things which you highlighted. But progress, Minister, must be judged on outcomes and not just those announcements. Too many older people across Wales, I've said, still face neglect and that domestic abuse. So, Minister, what specific measures will the government introduce to encourage and support older people to report abuse? And how will you ensure that they're met with a system that responds swiftly, respectfully and consistently when they do raise concerns? A central issue raised repeatedly by older people's organisations is accessibility. As I said, many older people feel that they cannot access the services, all those people who are there to help them. So when the government is designing these schemes, how can we make sure that they are not just, people aren't exempt from them for digital reasons? We need to make sure there are other ways people can access. We always tell people, please go online, but a lot of older people feel digitally excluded. So I'd like to know what you're doing in this space to make sure older people can get access to help more simpler. Another issue, it concerns capacity. If we're serious preventing abuse and frontline safeguarding of people, services must have the staff, the skills and the resources they need. At present, demand is continuing to rise. So, Minister, can you confirm what additional resources and workforce support will be made available to ensure that the services can meet the complex needs of older victims across Wales? You mentioned the work that the government's doing on tackling ageism, an issue that the World Health Organization identifies as a major risk factor for abuse. Ageism shapes how society perceives older people and, crucially, how services respond to them. But changing culture is more than simply just good intentions. It means about changing the way we all behave. So I may ask, Minister, how will the government ensure that the anti-ageism work stream leads to real behavioural and culture changes across the public services, and not just in public services, but wider across the society, because we can't just have another strategy which sits on the shelf and doesn't do anything. Yeah, Minister, I welcome this statement today because older people in Wales do deserve to live safely, independently and with dignity. They deserve to be listened to, believed and protected. And above all, they deserve a government and a society that recognises and values and acts decisively to protect them from all harms across the country. Thank you.
Well, can I thank James for those views and comments and for the general support for the plan and the direction of travel and what we're looking to do. And again, I think it's probably worth reiterating, this is the first plan of its kind in the UK. And so we're kind of like blazing a bit of a trail here for other nations of the UK to follow our lead. And what we're looking to do is to make sure that the age doesn't diminish the individual's right to be treated with the dignity that they respect, that they should expect. If you look across our society, one of the things that, to me, it always strikes me is amongst our volunteers. Our volunteers are predominantly older people, and they have a huge contribution to make to our communities. And we have to make sure that is not overlooked, that is recognised, and so on. So the overarching strategy really is about creating a Wales where ageism doesn't limit the potential for people to affect the quality of their lives, and more importantly, to affect the quality of the services that they receive. I think you talked quite rightly about data and the importance of data, and I indicated in my statement that this is the first year of the adult receiving care and support census. So we're still in the process of analysing what that data means, and we will be publishing the outcome of that over in the coming weeks. It kind of mirrors the pre-existing data collection that we do for children receiving care and support. So it mirrors that sort of process. But what data will do for us, and what this new form of data collection will do to us, is it will enable us to develop and to inform our decisions about the services that we provide for older people, particularly older people in our care system. And that's very much what we're aiming to do. We already collect data from local authorities and partner organisations, which is about monitoring the flows into and out of social services in Wales. But this is going to be a little bit more granular, and I hope will give us that reliable and clear understanding of how local authorities' care provision is changing over time and how we need to adapt that over time. You talked very specifically about digital exclusion, and I think that is something we know. The Older People's Commissioner has just published a report about that, and we're looking to do a significant piece of work in response, because older people still account for the largest demographic of those that are digitally excluded. And I know that from my own personal experience. I've got an 87-year-old mother. We taught her how to do FaceTime during COVID. She's kind of lost the memory of how to do that now. But, I manage her finances, and I deal with her bank, and I've got her app on my phone and so on. And being able to get her to do that might be nigh on impossible. The point of that is, I do that for her, but doesn't that potentially lead somebody open to financial abuse as well, where they are not able to do those things themselves and rely on others to do it for them? We've got a very clear programme for government commitment around that, and that's about equipping people with the motivation, the access, the skills and the confidence to engage with an increasingly digital world based on their needs. So there is a very clear need amongst older people, and really the work that what we need to do in that area has to encapsulate what the Older People's Commissioner's 4 main priorities are, and that's about awareness of rights, isn't it? It's about challenging discrimination, encouraging best practice, and the law affecting older people. And I think the final point that you were making there, James, was about workforce support and how we can ensure that we have a workforce that is able to effectively manage and support people with dementia. And I do think it is important to say that our dementia learning and development has been delivered through 3 key areas up until now. That's through the All Wales Induction Framework, where as a minimum all new workers are required to complete the All Wales Induction Framework, covering issues such as indications and signs of dementia and how to use that. There's also the Social Care Wales Workforce Development Programme, which is a comprehensive series of dementia learning and development opportunities, which continue to be provided to the whole sector regionally, in addition to the All Wales Framework. And the new We Care Wales Introduction to Dementia sessions are being run once a month, initially the first starting last month, actually in September, month before last. And those sessions are helping people to understand what dementia is and how those symptoms occur. But most importantly, will it be about how to support somebody living with dementia.
Diolch.